welcome all to Evergreen Nurses channel. Today I am going to discuss with you about newborn assessment. It is one of the important topic for theory as well as practical aspect. Now we can see detail about this topic. What is newborn assessment? Newborn assessment is a systematic assessment of newborn from head to foot to detect any deviation from the normal. So, this assessment can be done during the initial day of the newborn life. Let us see the aim of this procedure. First aim is to assess infant state of well-being. Next, to detect congenital anomaly and to detect significant medical problems. Let us see the articles required for doing this procedure. A tray containing hand washing articles, stethoscope, itch tape, torchlight, weighing machine, bowl containing cotton, infantometer, Macintosh, kidney tray or paper bag. Let us start our procedure with checking vital signs. Respiration. Respiration is one of the important aspect in order to assess the respiratory status of the baby and whether the baby having normal respiration or baby is suffering with any kind of respiratory distress. It can be assessed only by checking the respiration. The normal value of respiration is around 40 to 60 breath per minute, and it should be count for the full minute because irregularity of the respiration is common among newborn babies. Next we can see the heart rate. The heart rate is around 120 to 140 beats per minute. It should be assessed with the help of stethoscope, and we have to check the heart rate for the full 1 minute because irregularity of the beat will be common among the children. Then temperature, the average temperature is around 36 to 37 degrees Celsius. The temperature of the newborn should be checked either through axilla or rectal. After checking the vital signs, we can do the anthropometric measurement for the newborn, in which we can assess the height, weight, head circumference, chest circumference, all those things. So, the length of the baby is measured by infantometer. I have already taken class regarding this infantometer in my earlier class. The average length of the newborn is around 50 centimeter. The head circumference of the newborn is around 33 to 35 centimeter. The chest circumference of the newborn is around 30 to 33 centimeter. It is measured at the level of nipple and it is about 2 centimeter less than the head circumference during the infancy period. The average birth weight of baby is around 2.5 to 3.5 kg. Weight of the baby can be measured by infant weighing scale. Vital signs and the anthropometric measurement. We can start the assessment from head to foot. First we can see the position. The baby lies in supine position with the partial flexion of both extremity that you can see in this picture. Next we can assess the skin. The neonate skin is soft and smooth. Vernix caseosa. At birth, newborn skin is covered with a white cheesy-like substance is termed as vernix caseosa. You can see this condition in this picture. It should be removed thoroughly and cleaned before handovering the baby to the mother. Next we can see lanho. It is a fine downy hair that present all over the body. This is more commonly present in preterm baby than the term baby. Now we can see the peeling of skin. Peeling of skin is a rare condition and it is common among postterm baby than the normal term baby. No specific treatment is needed for the peeling of skin. Let us see milia. Milia is a small pinpoint white papule. It can be found in cheek or bridge of the nose and it will disappear within the month. And erythema toxicum is a reddish rash or papule present in newborn skin. especially in the face and upper body part, and it also will disappear within a week. Then we have to assess for birthmarks or injury. It is common and it is occur mainly in instrument used delivery like forceps and LSS. So it can be seen in the head and face. Assess for any Mongolian spot. It is a bluish discoloration rashes that is commonly seen in back of the baby. You can see the Mongolian spot in this picture also. So after completion of the skin, we have to start our assessment in the head. In the head, we have to assess the fontanelle. So as we all know, there are two fontanelles are there. First one is the anterior fontanella and the second one is the posterior fontanella. In anterior fontanella, it is diamond in shape and it closed around 1.5 years. Whereas the posterior fontanella is a triangular in shape and it closed around. Assess the fontanella for any evidence of bulging or depression. Bulging of fontanellas occur due to increased intracranial pressure and in case of hydrocephalus. Depression of fontanella you can see in case of dehydration. Assess the suture line for any evidence and separation. Assess the size and shape of the head is very essential. So there will be an evidence of hydrocephalus, microcephaly and macrocephaly. Microcephaly, here the size of the head is small than the normal size, whereas the macrocephaly, the size of the head will be larger. Both conditions are mainly occur because of congenital. You can see clearly the microcephaly and macrocephaly in this picture. Next, we can assess the head for any evidence of caput succedaneum. It is a swelling or edema present in the presenting part of the vertex. It can be seen in normal delivery baby. It can happen due to prolonged labor. Then we have to assess for any evidence of cephalohematoma, in which blood collect between newborn scalp and skull. Then we have to assess the eye, assess for any abnormal eye discharge, subconjunctival hemorrhage. Check for any evidence of ophthalmia neonatrum. Ophthalmia neonatrum is a common condition and it occurs mainly among vaginal delivery baby. Assess the ear for hearing ability. This can be done by testing statal reflex or by clapping the hand. The baby will respond to this stimuli. Assess the position of the ear. Low set ear indicate Down syndrome. Examine the symmetry of both ears. Then we have to assess the mouth. Epstein pearl is one of the condition. Here there will be a whitish pearl like substance that is present in the oral cavity, and you can see this condition in the slide clearly. Now we have to assess the baby mouth for any congenital defect like cleft lip and cleft palate. Assess the tongue for any evidence of oral thrush. It is a white patchy substance that is present in the tongue due to fungal infection. Next, we have to assess the mouth for nasal teeth. It is a rare condition. Here, some babies born with one or two teeth during the birth itself. This natal teeth is otherwise called precocious teeth. Then we have to assess the nose. Choanal atresia is one of the congenital condition in which one or both nasal passages are blocked. So, check the bridge of the nose for any depression. Depression indicate the child may suffer with this Down syndrome. Then assess the nose for any nasal discharge and flaring of nair. Flaring of nair indicate the child is having respiratory distress. After assessing the nose, we have to assess the neck. Assess the neck for any congenital malformation. You can see this slide, the head held in one side with the chin pointing to opposite side due to malpositioning that happened during the intrauterine period. So this condition is called tachycolis. This is one of the musculoskeletal anomaly of the newborn and assess the neck for the range of motion. After assessing the neck, we have to assess the chest. Newborn chest is parallel in shape. Assess for any abnormalities in the size and shape. Assess the chest movement for any evidence of abnormal movement. Abnormal movement of the chest indicate dyspnea. After assessing the chest, we have to assess the breast. Assess the breast of the baby for any engorgement and the presence of witch milk. Witch milk is a thin milky discharge that occurs due to stimulation of maternal hormone. It will disappear without any further treatment. So then we can assess the abdomen. Usually the newborn abdomen is soft. Assess the abdomen for any evidence of herniation because umbilical hernia is the common condition in the newborn period. We can assess the abdomen for scaphoid. The scaphoid abdomen is commonly seen in congenital diaphragmatic hernia, and also we have to assess the bowel for any bowel sound with the help of stethoscope. We have to auscultate it. So it will be present within 1 hour after birth. Then we have to assess the umbilical cord. Assess the umbilical cord for any evidence of infection and bleeding. So in umbilical cord there should be 2 arteries and 1 vein. If any deviation in this, that indicates the baby suffer with some kind of problem. Then we have to assess the back. The spine of the newborn typically appears flat in lumbar and sacral area without any defect. We have to assess for any evidence of defect in the spine for spina bifida, meningeocele and meningomyelocele. These are the rare conditions of the spinal tract. Then we have to assess the anogenital area. The anus of the newborn must be inspected for patency. It can be easily detected while checking the rectal temperature. Absence of anal opening is called anal agenesis. Then we have to assess the genitalia for any malformation or any sexual ambiguity. Then in female genitalia we have to assess for pseudomenstruation. It is a rare condition here, the presence of vaginal bloody discharge. It is seen in female baby due to withdrawal of maternal hormone. After that, we have to assess for any abnormal connection like vaginal fistula. Then in male genitalia, we have to assess for any evidence of undescended testes. It can be assessed by palpating the scrotum. Then you have to check for urethral opening because in some babies there will be a abnormal opening will be present. There are mainly 2 abnormal opening, that is hypospadiasis and the epispadiasis. Hypospadiasis in which the urethral opening in the lower aspect of the penis, whereas epispadiasis the urethral opening in the upper part of the penis. After assessing the genitalia, we have to assess the extremity. Assess the extremity for the range of motion like flexibility, mobility. Both upper and the lower extremities should be assessed properly. Then we have to assess the hands for any extra fingers, that is called polydactyly. Assess the hand for any evidence of syndactyly, that means webbed fingers. Then assess for congenital anomaly of the foot like clubfoot. After completion of all the assessment, we have to ask the mother about the elimination pattern of the baby. Normally, baby has to pass meconium and urine within 24 to 48 hours of birth. So, till now we have discussed about the newborn assessment. I hope this video will be useful for you. Thank you for watching.
Please like, share and subscribe.